You combine the glasses with a bit of peanut butter in the mouth, and I think we've discovered a new segment for the show. So lest we forget, it is a Wellness Wednesday, and we've been getting to know our new partners, Medicare, who offer some incredible pharmacy solutions and healthcare solutions over and above their incredible products as well. They really are changing the game. So today being a Wellness Wednesday, Ewan is about to sit down with the CEO of Medicare to talk about how they are changing the pharmacy game.
Once again, it's Wellness Wednesdays here on your Feel Good Breakfast Show with Medicare, and today we're going to talk about affordable healthcare under one roof. Now, in studio today, we have Tim Knapp joining us again, Medicare CEO, and he's going to tell us how Medicare is reinventing the role of the pharmacy in your healthcare, and I love that. Tim, welcome back. Lovely to have you.
Morning.
Cool. So, Medicare, what are you guys doing to reinvent the role of the traditional pharmacy that we've known for so many years?
Yeah, I think quite a lot. I mean, it starts with we're trying to basically put as many primary healthcare services as we can under one roof, right? Just to make access easy and affordable for everyone. That's really where we start. What we have done right now is already to bring in a doctor, right? So a general practitioner into pharmacy. So some of the other innovations with that doctor already is that means we've got weekend doctors available, right? We've got doctors available after 5 p.m. Some of our stores trade quite late, but seeing a doctor at 5 p.m., 6 p.m., 7 p.m., is now quite easy. Some of the things we're trying to do in the medium term is actually expand the services that you can get through that doctor in the pharmacy. So we're testing things this year like bloods in pharmacies, so being able to draw bloods and get blood tests done, bringing in a lot more point of care devices so we can expand the areas that we treat, so actually being able to do things like full cholesterol checks, full blood sugar checks to help diabetic or patients with high cholesterol. So we're testing already in a couple clinics. We've got an endoscope or an otoscope, and it's something you use to look in ears and mouths and those types of things. So it's a digital device that our doctor sitting in Zanin or in Johannesburg, wherever the doctor may be, we'd be able to look in your ear sitting here. Sure. And similar on stethoscopes and a number of other devices like that.
Yeah, and I love the fact that it's almost leaning towards a clinic. Yet it's a pharmacy. We can still get all your day-to-day things. You get your medications and everything. So if you had to pinpoint one thing, what would you say sets Medicare apart?
We're trying to reinvent the healthcare system to some extent, right? And we really, when we look around, not just the South African healthcare system, but other healthcare systems, we don't think they work for a lot of people, right? It's hard to get access to a doctor. That takes time. It takes a fair bit of money. We know what's happening to everybody's healthcare costs, whether you've got medical aid premiums or whether you're just paying out of pocket. So how do you really start to help people manage that in a very different way? And that's really what we're trying to do. But we're trying to do similar things in the dispensary, and still to make that front shop experience, because you can't just come to a clinic to get medicine and get doctor services. We all still need to buy a whole bunch of things to just make our lives work on a monthly basis, right? And so being able to make that all happen under one roof at great value.
I love the fact that you're taking a look at the lifestyles of people nowadays, being very, very busy. And for a lot of people, taking off work means not getting paid.
Absolutely.
And that's the thing, we can't afford to take the whole day off. So I love the fact that you are flipping the script a little bit here and making it accessible for people and at an affordable rate as well. Taking a look at the future, what's in the pipeline for Medicare? Where is it that you guys are heading? What's the vision?
Yeah, so I think a few different things. I think one is obviously to continue to expand our footprint. I mean, we're at almost 50 stores. But are not covering the country yet. So we've got a fair amount of expansion to go through to actually try to bring our model to different people in different parts of the country. The other things is some of the things I spoke about already. Just to say, one, we want to be able to provide more services under that roof. Right. Right now we're doing the very basics of primary healthcare. We really want to be able to expand and say, well, you can come to us for almost everything. Right. So we're introducing those things like devices, equipment, lab tests, so as many things as we can to make life easy. That's one big thing that we're pushing forward on. So we're doing quite a lot in the front shop. I think there's a lot of excitement that will come through us over the course of this year now that we're starting to get bigger and better known. So you can look forward to seeing some pretty exciting pricing and promotions and just availability of stock that I think we don't currently have, right? So that'll be coming over the next few months as well. We have lots of other ideas that I think we'll see over the coming years, but it's probably a bit early to be talking about about some of those at this point.
No, that's brilliant. Tim, thank you very, very much. Really appreciate it. The future is bright, and that's what I can say. I'm going to be there. I'm going to check it out as well. I'm going to experience the journey with you guys. But once again, thank you very much for joining us on your Wellness Wednesday here on Express. I really appreciate it. So the next time you are not feeling that great, pop in at Medicare, the primary destination for professional and affordable healthcare.
Medicare, reinventing pharmacy for you.